Hi guys, welcome. We are so excited to talk to Amanda about her experience as a heart transplant recipient. Hi, Amanda.
Hi,
So,
thank you for having me.
so the group has been super excited about learning from you, your experience. I know you're a huge advocate for normalizing transplants and you have a passion for educating others, which is how we got connected. So I'm so thankful that one of my nurses encouraged me to reach out to you, or maybe it was the other way around, but regardless, we're connected and I'm glad. So lots of viewers actually submitted questions ahead of time. So that's going to be great. And we can get those answered. And anybody that's tuning in live, you can please put your questions in the comments and we'll get your questions answered as well. So we're just going to talk about your life pre-transplant. We're going to talk about what it was like being a patient as well as post-transplant. And we're going to ask some questions as they fall into line with those subjects and categories. So Kevin asked, what was actually, do you have anything you want to introduce or talk about before we get started?
I'm sure things will come up while we're talking and we'll, let's just play it by ear and go with it.
Perfect. Okay. So Kevin asked, what was the moment you realized you were sick enough for a transplant? So you can tell your story and let us know what led you to that.
Sure. Yeah. So in 2013, I had my baby, Cassidy. Super normal pregnancy, healthy, great birth. Everything was fine. Everything was perfect. The baby was wonderful. And shortly after, I would say less than a week from being home, I started to develop a lot of shortness of breath, a heavy chest. I couldn't sleep. I couldn't breastfeed. There was a lot of things going on, right? So the only place that could get me in right away was an urgent care. And I went in, and that's actually when I was told I had postpartum depression.
Wow.
What's that? And I was actually seen by a few doctors, emergency, my OBGYN, and my primary care, all of which came up with different diagnoses of pneumonia, bronchitis. It was all were wrong. So then I ended up going into, I was actually in total heart failure.
Wow.
And finally, someone caught it. I had peripartum cardiomyopathy, which is extremely rare.
Okay.
But during my stay here in New Mexico, we tried all kinds of medication therapies. Like the biggest one was melronone. We know that that's cardiac rocket fuel, right? And that did nothing for me. So at the time, New Mexico didn't offer Lvads, and we still don't offer heart transplants. So I was actually shipped off to UCSD in San Diego, where I'm from. So it worked out, and my parents live there. So, at least I had family. But anyway, so, long story of how I got to the point of transplant. But during all of that, I never actually wanted to believe I needed a transplant. I was always in denial that I needed one, always. But it was when I really accepted the fact that I needed a transplant was when I actually developed a driveline infection on my Lvad, which is it's common.
Okay.
But mine hit me bad, and I ended up having an open incision procedure where they lined inside my scar, right inside my chest, by my Lvad pump. They implanted some antibiotic slow releasing beads, and then I had a wound back on. I was so sick and so weak, just emotionally and physically, that's the moment I was like, I can't do this anymore. And so it wasn't necessarily when I realized it was when I accepted it.
Yeah.
I realized that I needed a transplant probably when this all first started.
Wow.
Just didn't want to believe it. Yeah. So
that's really interesting. So, Jamie asked, what did you feel like the contributing factors were that led to your misdiagnosis? And I think you said 4 times. Am I right?
Oh, yeah. Yeah.
Okay. So, 4 different providers misdiagnosed you. So, it's rare. So, that's a big part of it. What else do you feel like contributed to that misdiagnosis?
So definitely the rarity of the disease. There's not a lot of education or awareness about peripartum. It's just not out there, right? Also, it was the time of year that I got sick, the end of November, cold and flu season. And then also, like, I had x-rays done, and they showed there was fluid in my lungs.
Okay.
The unfortunate thing is that I didn't know how to advocate for myself, that I needed more than an x-ray. Great, there's fluid in my lungs, but no one knew that was blood. But we would have known if I had advocated for something else to be done, right? But then, when I was first diagnosed with postpartum depression, I honestly think that was that diagnosis was honestly due to me just being a young woman who had a baby.
Yeah.
It was an easy diagnosis, and it was due to a gentleman who spent 2 seconds with me.
In the urgent care, your initial visit?
Hmm?
Was that in the urgent care on your initial visit?
Yeah.
Yeah.
Yes. Yeah. So, he walked in, looked at me, looked at my chart, said, "Oh, you're 28 years old. You just had a baby. You're probably having a rough time. You should take a vacation," is what he said. Yeah.
That's crazy with a 1-week-old baby, right? I get postpartum depression is also underdiagnosed or misdiagnosed. Yeah. I know that the information and education is really being pushed in terms of that.
Yes.
But my goodness.
Yes. It's very real. Postpartum depression is very real. We all know this. But, in this case, it was just used as an easy diagnosis, which is so unfortunate. I wasn't depressed. I mean, that came later on.
Yeah, for sure.
But, that wasn't what it was going on. And I think if he had spent a little bit more time with me, quality time with me, he would have figured out it was something else.
For sure. So you required an Lvad. Jerry asked about that, and we already discussed that. Yes, you did require an Lvad, but Jamie wanted to know what was it like living with an Lvad, and how long did you have it prior to transplant?
Sure. I hated it. So everybody who has a Lvad will answer this question differently. We all have different experiences with it because it's such a unique situation. But my body did not respond well to the Lvad. Thankful for it.
Right.
But I hated it. I am someone who loves water. I had to physically prepare to take a shower, a simple shower. I had to do all these things. I was in San Diego, where I'm from, and I couldn't jump in the ocean. So it's like, and then I had a newborn, so I couldn't hold her correctly, So I hated it. There are some people who actually opt to have the Lvad prolonged than to get transplanted.
Wow.
I am not one of those.
Talk about what an Lvad is for people who don't know.
Oh, absolutely. Absolutely, yeah. Okay. I talk about it so much that I just think people know what an Lvad is.
I know.
So an Lvad is a left ventricular assisted device. When the left side of the heart fails, this is a pump that hooks into the left ventricle, and it allows for blood flow. There's also RVADs. Some people even get an RVAD, LVAD, so they have 2 at once.
Yeah.
And so then the pump itself is actually powered by a drive line that comes out of one's belly, and that drive line is hooked to a backpack full of batteries. So that is how I lived. It was very dehumanizing. It was like, I was literally Iron Man. You know, I had that thing, and it's 7 pounds, so it's not light. And then on top of that, you have to carry around a backpack full of batteries with you at all times.
And some people are discharged from the hospital. Were you discharged from the hospital?
I was, yeah.
Especially maybe because you had family there nearby. Yeah, that's
right. Yeah, and there's actually a lot of people who, when they get their LVAD, they can go back home, like home
nice.
to the and as long as they're close enough to go to clinic. Like we have a lot of people, not a lot of people, but we have individuals here in New Mexico that go and travel to Arizona for clinics. You know, so it just depends. But because of the severity of my heart failure, we felt that it was best that I stayed in San Diego.
Yeah.
But I was discharged about a month after my implantation.
Okay. And then how long from LVAD to recipient? How long was that? Or LVAD to transplant, I should say.
6 months.
Okay. That's a considerable amount of time.
It's a considerable amount of time, but some people are on a transplant waiting list for years.
Right.
You know, because of my infection,
yeah.
And also because I was so young, and before this, I was really healthy. I'm super healthy. So because of my health, my age, I had a newborn, and I had a infection ruining my body.
Yeah.
I was put to the top of the list. If I hadn't had that infection happen, I don't necessarily think I would have received my heart as quickly as I did.
Yeah, for sure. So let's talk about what being a patient is like was like for you. I guess it still kind of is, because I mean, you're still a patient now.
I'm always a patient now. Yeah.
Yeah, great. But so let's talk about what it's like being a patient, and
Sure.
How did you have your nursing degree before this?
No. So I was actually I was an MA, and I was a surgical assistant. I actually was a surgical assistant in the morgue.
Okay.
And I loved it.
That's
so
amazing.
I came into this situation with a pretty vast knowledge of, anatomy in the body and what was actually going on.
Okay.
Yeah.
And then you got your RN after transplant?
No, so I don't know. I am actually a care manager, but we do not have RNs. We don't. Yeah.
Okay. So I have that wrong in your bio then. So let's move on to what it's like as a patient. Kevin wanted to know how long recovery was after transplant.
So the immediate recovery is about a month. I mean, I was in the hospital for a month.
Okay.
Some people who get transplants are released like 2 weeks after their transplant. I was not that lucky. Again, I had that severity of the infection in my blood. So I had to stay longer. But they give you about a year for recovery.
Wow, that's
I honestly think it's longer. For me, it was longer. In New Mexico, transplants are not. You can't get any disability if you had a transplant. So it's not an accepting reason to get a disability. So I went back to work immediately as I could, and I think I went back to work too soon.
Oh wow.
Yeah, at a year post transplant, I went back to work, and it wasn't good. So wow. Full recovery for me, I would say it was about a year and a half.
Okay. So what were your biggest questions going into the procedure? I'm pretty sure this was Jamie that asked that, but I forgot to put who it was.
Anyway. Sure. So I had a lot of questions, but of course the biggest one is mortality rate.
Yeah.
What are my percentages here? It's the thing that's on everybody's mind.
And what was that like?
Yeah, and it's and any surgery, that should be your question, right?
Right.
Let alone a heart transplant. But also it was like, how long is recovery? What am I going to feel like? What are the drugs that I'm going to have to take? And what are those side effects going to be? There's so many things that change. So I had a lot of questions, and everybody, nurses to doctors, were super patient with me, answering all of my questions, but and also answering all of my husband's questions and my mom and dad.
Absolutely. Sorry, go ahead.
They had very unique questions all in their own.
Yeah. What do you feel like? Sorry, if you're comfortable talking about it, what was the mortality rate as it was presented to you prior to surgery?
Sure. So again, pretty unique situation with my infection.
Right.
And then we had the fun challenge of my antibodies. So I had at one point, so I've had 3 heart offers.
Okay.
So my first heart offer, my antibodies were too high. And then my second heart offer, my antibodies were too low. So when my third heart came in, and we called it the Hail Mary transplant, meaning we're just gonna go for it, right? So my percentage rate right there for me was 50-50.
Wow.
That's pretty scary.
Yeah, that just gave me goosebumps.
Yeah, because it's like, if we don't do this transplant, I probably had weeks to live. If we do this transplant, we're pretty sure it'll take, but we're not 100% on this, and so they had to give me the best that they could, was 50-50.
Yeah. Wow. Absolutely. So, well, I'm thankful that everything went well and you were in favor of the 50%.
Yeah, it's a perfect heart. It was a perfect heart.
That's amazing. And I'm so thankful for that person that, donated, that family that chose to donate organs.
They are amazing.
Yes, we actually have another Q&A with a nurse that actually works with organ recovery. So if those of you who are interested in the nursing side of all of this, you should take a listen to that Q&A. Really, really interesting. So Candace asks, what did the nursing staff do that put you most at ease?
They treated me like a person. Like, I wasn't a patient necessarily, but my husband stayed with me every single night. Like, he was always with me. And so it wasn't just, hey, Amanda, do you need anything from the snack room? It was, hey, Amanda, Nate, do you need anything? So just, especially when you're like, you're there for such a long time, you stop being just a patient. You become like a resident of the hospital. That's your home now, right? And so everything that they could do to make me feel more comfortable, even if they weren't supposed to, they would sneak me in like food that I would want from the outside, letting me just sneak out of my room to go outside, things that you need to breathe fresh air sometimes. And they would go on walks with me.
That's awesome.
So just talking to me, have conversations with me.
That's great. So someone else asked, thinking back to your favorite nurse, what did they do that made their care a little extra special?
Sure. So I have a lot of favorite nurses. And that's a sign of a good healthcare system, is if you have so many favorite nurses and you have so many good memories rather than bad, right?
Yep.
There was one of my nurses, Connie. She was very motherly to me.
Okay.
Because I couldn't have my mom with me at all times, and so she would be there just to hold my hand and have that energy of, like I said, that motherly energy towards me. And then my favorite nurse, Carly, she and I we're about the same age.
Okay.
and just coming, sitting with me, talking with me, and giving me just time to get my mind out of the situation I was in. Like, you don't, as an RN, you all don't have to change sheets. You don't have to do this. You don't have to do that. You don't have to go get graham crackers, and you don't have to do all that. But she would just sit there and make my bed, and we would have a conversation. Like, it was the best. Yeah.
It wouldn't surprise me if she's in this group because we have so many New Mexico nurses. And so
she's the San Diego one. She's
from San Diego. Well, we have from all over the country here in the group, but that would be so cool if she was in the group and actually got to hear you.
I hope so.
Yeah, that would be super neat. That would be super neat. Your daughter was Cassidy, right?
Yes.
Did she to come and visit you at the hospital some?
Yes, and that's one thing that they did that I should have mentioned that they did to make it such a good experience is so my kid had a walker. She was learning how to walk right after my transplant, and she had a walker that they would just let her go around and round and round the floor. She would go and visit patients with nurses. If Nathan and I were just exhausted and needed a break, and my parents weren't around, the nurses would take her.
Oh, that's so precious.
Yeah, she would. She would hang out in the nurses' station. Like, I'm pretty sure they liked her a lot better than they liked us. But
that's so
blame them.
Smile she brought to all those fellow patients on the unit.
Oh my gosh! And my husband would dress her up in costumes, and they would go and visit other patients. I was always the youngest on the floor, always. So that a little baby just brought so much joy to the nurses who don't see their kiddos all the time either. The doctors who never see their kids. So they definitely made our temporary home full of love.
That's
for all of us.
I love that so much. Sarah asked if you could change anything from start to finish from your transplant process, what would it be and why?
I would have started seeing a therapist sooner, way sooner.
Good.
I didn't see. So I saw a hospitalist psychiatrist like once, and he was a retired Marine. It was terrifying. So I didn't, I was totally turned off by that idea. But I honestly needed someone who had a biased opinion and was not part of my family to help me through a lot of my emotions that I was going through. So I definitely would have started therapy a lot sooner.
That is great information for us as a healthcare team because we can bring that forward when the patient's not in a place to say, hey, I think I need therapy. At that time, you're so overwhelmed. You're not thinking about what's going to help you right now. And you're probably not in a state where you really want to open up to a third party. But we can advocate for that.
Yeah, and my physicians, as the amazing physicians I had, they were really concerned, of course, with curing my heart. Right? It didn't really occur to anybody to work up here too. Like it kind of had to take a back burner, and it did, and I guess it burned me in the end because. We had a lot of issues after transplant.
Well, I'm really thankful that you brought that to light and that you've gotten help. I think as Americans as a whole, we tend to think about getting help as a weakness. And I'm sure as that it's not a sign of weakness. It's a sign of strength to say, I need help,
Yeah, one of my doctors put it so clearly for me is that we exercise our bodies to keep our bodies strong by going to the gym or, however we decide to exercise. Going to a therapist is just exercising your mind, and to keep it strong and to keep it healthy. Like, there's no shame at all.
I love that. That's a great analogy. So
Yeah.
Sarah asked, what was your favorite memory while in the hospital and what makes it stand out? I think you've covered some of those. Do you have anything else that really stands out to you?
Yeah. For me, it's okay. So, the heart monitors. I figured out how to take mine off and make it look like I was still there in my room.
How did you do that? We need to know.
So I would, so the obviously the leads are still on, right?
Yeah.
There's a little thing in the plug
Yeah.
that if you flick it, it looks like you're still there, like that you haven't unplugged.
That's so funny.
So anyways, but I would escape, and sometimes it was by myself. Like if my husband wasn't able to get to me for a while, I would just escape, and I would go and just walk and go to visit different hallways and the outside courtyards and stuff like that. But really, my favorite was when my husband was with me and we just had alone time. No beeping, no blood pressure machines, nothing. It was just pure silence and we could be together. And of course, watching Cassidy learn how to walk, like just having her there. The first time I saw her after transplant was awesome. It was like, because I went into this OR. Her and my husband walked me down to the OR, and I kissed her, and I'm thinking, this is the last time I'm going to see you. This is the last time I'm going to see my baby. Because the odds weren't they weren't good at all. And then just to wake up and there she is, and I'm up here, and we're a family. It was like, that was good.
That is amazing. Yeah. I'm going to cry now. Okay.
Oh, great.
All right. Now, that is an amazing memory. And I'm so thankful that she was there to wake up with you. That's.
Oh, yeah.
So, is there anything that we missed during your hospitalization that you want to cover that we didn't already cover?
Oh, okay. So I have, we talked a lot about the good, like the good nurses and the good things that they did, right?
Yeah.
We all have bad experiences. You all are running on graham crackers and peanut butter. Like, let's be real. That's what you guys eat and live off of.
Right.
So grumpy. We all do. There was some instances where like I had I had my Lvad, and it was a relatively new model, and a nurse came in wanting to check it out. And I was like, sure, yeah, go ahead, check it out. Well, she was fiddling with it and unplugged it. And yeah, and I fell asleep because if you unplug your Lvad, you pass out, right?
Circulation.
Right. So thankfully, my husband was with me, and my alarm started going off. My Lvad alarm started going off. So we plugged me right back in. So learning about new things is super cool. Don't mess around with them unless you know what you're doing, right? Because it could be super detrimental if you do.
Yeah.
But and we all have bad days. You have probably been called 7 times within 5 minutes. You have been asked, where are my meds? Have you gotten my lab results back? But just got to understand that these people, time stands still when you're a patient in the hospital. Mm-hmm. All you can do is think about, have my lab tests come back? What did they find? So you are super anxious, and the only person that you can talk to is your nurse.
Yeah.
And every patient should be so thankful, but people are going to be jerks. I mean, that's just people just are. I tried to be as thankful as I could to every single nurse that came my way, but I had bad days too. So I would just, patience with your patients.
Absolutely. And the way I like to put that to my new nurses that I precept, or, people that I can feel being burnt out, is that our patients have no control. They're out of control, sitting in that bed with everybody else telling them when, what, where. It's all out of their control. So giving them some control back, allowing them that flexibility to say, hey, you know what? I'm drawing your labs at this time. I would assume that between this time and this time, they should be in the system. If I don't come tell you what they are, feel free to let me know. Give them a time frame, because
Right.
I will watch that clock. And as soon as that clock strikes noon, when you said that the lab results might be in,
they will call you.
And you know what, though? But when you see that call, that gives you a cue as the nurse to be like, right, I didn't check for Amanda's labs, and I told her I would. So I just feel like we can all help each other stay accountable, and knowing that you've lost all ability of having any control over your own life. It just lets us empower you a little bit to know that it's okay. Like, hey, yeah, ask me, please. Like, let me know, remind me, because I might forget.
Right.
It gives you a job, and everybody likes to have a job. So that's what I like to do with, I was a pediatric ICU nurse, give my parents a job, and they love that. And if it's an older something, you have to give them a job, give them something to look forward to from the monotony. Like you said, it all just stands still. All you can think about are those lab results coming through.
Yeah. Oh, exactly. Yeah. Especially, for the husbands, for the wives, my husband in particular is a very strong man, very protective, we're his world, right? And all that was taken away from him. Like, he could not help me. There was nothing he could do to help me. And so when the nurses said, Nathan, let me know if you need anything. Let me know if you haven't heard anything. It gave him that sense, I think, of, okay, I got something to do.
Yeah, right? It's true. It's so true. Thank you for that.
And they also taught him how to do certain things. So bed baths, dressing changes, simple things that alleviated some stuff off of them.
Yeah.
But also gave him purpose,
Absolutely. I love that. Giving them power in your care. It's so helpful. Anything else that we can do as a profession to make your admission better? What else could we do? Do you have any other pointers?
I'm sure I do. It's the giving me back my power, giving me back my purpose, treating me as if I'm just your friend. I think it was easy for me to make friends with my nurses because, one, I had been in the medical system, like I knew some things that they were talking about, so we can, kind of shoot off of each other things, right? But also I was the same age as a lot of them.
Yeah.
Now, say, like in my business, I deal with a lot of geriatric patients.
Yeah.
Ask them to tell you some stories. Ask them to tell you things that that interest you. I'm sure they have a lot of them.
Yeah.
Bedside manner is real, and I think it needs to be taught over and over and over again because people lose that. And also, as a nurse, you have so much power. The hospital will not function without you. And thankfully, I had some very humble, most of them, doctors who knew that. And if you are working for a doctor who does not know that, get your power back. you know the power you have. Like I said, the hospital would fail without you. And I know that, and so many other patients know that, and we're so appreciative of just everything you all do.
That's great. Yes, absolutely. So let's talk life after transplant. What does that look like for you in terms of maintenance and follow up? How does it look differently now than post pre transplant?
Sure. Well, pre-transplant was super fun. I could do whatever I wanted, you
Yeah.
know. Um, and then uh, literally everything throughout my day is you have to just think before you do something, right? I take pills, anti-rejection meds. I take two different kinds every day. And I will for the rest of my life. I take a statin, an aspirin, and amlodipine.
Okay.
So I'll take those for the rest of my life. And because of the anti-rejection meds, there are a lot of things that I can't do. So come cold and flu season, or COVID season, I can't go out. I can't go to the store. I can't. There's a lot of like patios open. I can't go. So we have to be careful. A simple trip to the dentist is a whole event. I have to take a lot of antibiotics before I go. Same thing goes if I get a a facial,
Oh,
like with certain facials, certain things. So you have to think one step ahead of everything that you do. From the food you eat, if I go out with my girlfriends to have a glass of wine, I got to make sure that I, only have one or two. like, so yeah, it's just thinking a lot of just a lot ahead of all of your actions.
mm-hmm.
Um, I get tired really easily, which surprises a lot of people. They're like, "You're 6 years out, like you shouldn't be getting tired." It's like, no, you don't understand. Like it's the medications that we're on.
Mm-hmm.
I can't tan. I can't be in the sun. And it's weird things started to happen. Like I lost all the color, my new hair growth is all gray and curly.
Ah. And is
Yeah,
that the medication or?
yeah. So the anti-rejection meds.
Yeah, interesting.
Yeah, so it's just it's a slew of weird things, and not everybody is the same or will have the same reactions. So thankfully, I talk with other transplanted women who they have some of the same issues as I do, and some of them are completely different.
Mm-hmm.
Like one of my girlfriends developed psoriasis.
Oh,
I developed endometriosis.
wow.
Again, it's yeah. So life after transplant is hard, but it's worth it.
Yeah, for sure. So, what do follow ups look like in terms of your medical follow ups and appointments and things of that nature?
Yeah, sure. So after transplant for about a year, I had to go for a biopsy about every 2 weeks.
Okay.
After 6 months, it went to like every month. And then after 6 months, it was like, so, it tapers down, right?
Yeah.
And then for 5 years, annually, I would have to go for a cardiac catheterization.
Okay.
And that's either can go through your wrist or they can go through your groin. Because of all of the IVs that I've had during my time in the hospital, my wrist wasn't an option anymore.
Okay.
So I would have to get cardiac cath. Then you have to go see all the specialists. So you have to go for a yearly dermatology appointment, dentist, optometrist, OBGYN, all of them once a year. And now that I'm 6 years out, I will go for a simple stress test, CT scan, and probably like an MRI, blood work, stuff like that. But thankfully, after 6 years, or 5 years, I'm sorry, after 5 years, you're good. That's like their you're over the hill. Like
Okay.
So after 5 years, we're like, all right, you're good. Later.
That's awesome. So you've reached that benchmark, and now you're given the thumbs up.
Yeah, it was a huge deal when I reached that 5 years. And one of my doctors, my main doctor, told me your world won't be normal for 5 years.
Okay.
And I was like, whatever. I'll get my life back in 2 years max. He was right. Financially, mentally, and physically, took 5 years.
I'm so glad that you're past that 5-year mark and here with us
Me too.
to share your experience. So if we're advocating for patients and recommending support and resources to them, what support and resources would you recommend so that we can pass that information on?
Sure. So you can always use me. You can always use me.
Good.
But I fell in love with the American Heart Association. They started having me speak with them and advocating with them really early on, actually, when I still had my Lvad.
Okay.
Yeah, so it was a way for me to find other survivors. It was an outlet for me to find just life tips and hacks for the transplant world. That was huge for me. Donate Life was wonderful because, again, I could, or donor services, whatever you have in your area.
Yeah.
But they were a wonderful resource to connecting me with other transplant recipients, as well as donor families. Because, okay, so when you have a transplant, one of the biggest issues is transplant recipient guilt. It comes relatively early on.
Yeah.
You wake up, you're super thankful, and then you're like, oh my God, someone had to die for me to live,
Right.
And that sticks with you, and it's heavy. So speaking with donor families who made that choice is so wonderful. I am lucky enough to have a wonderful relationship with my donor family.
I love that.
Yeah. So I got that help and that healing firsthand from my donors' kids. I needed that, and recipients need that healing to know that it's okay that we live and that we're carrying on that life.
Amazing.
So those are the two resources that I would definitely give out right away. And also your local hospital's foundation. I'm sure they have plenty of local resources.
Okay, great. And in closing, do you want to tell us a little bit about what you do and how you advocate for normalizing transplants and really help educating fellow nurses and other medical staff?
Absolutely. So in my profession, I actually started doing care management. My husband's a guardian for adults with developmental disabilities and individuals that are either like deemed incapacitated by the courts, right?
Okay.
A lot of these individuals have not made the decision of their end-of-life plans. And in my head, I was like, hey, have you thought about organ donation? It's just a way for me to really talk about it with I think a generational gap that doesn't really think about that. So we have people that are over the age of 70 who think that they can no longer be donors because of their age, and that's absolutely not true. So everybody should become a donor, and I advocate for that. Everybody should. And also normalizing that transplant recipients are not sick. We're not sickly. We don't look sickly. I don't look sickly. I mean, some days I do, but I don't usually look horrible. And also that we're young. Transplant recipients don't always what they call it, do it to themselves, right? So I wasn't a heavy partier. I wasn't, a crazy smoker, and I didn't do this to myself. So just because I needed a transplant doesn't mean I did something bad. And also that and with, heart disease is that women often get overlooked in the medical system. I'm a prime example of how symptoms can look like something completely else. So what are the symptoms of a heart attack? I was experiencing a heart attack for days, no idea. So I work really hard in talking with hospitals, OBGYNs, nurses, such as, groups like this. It's just anywhere that I can get the message out, I'm doing it.
Well, we so appreciate your time, and I'm so thankful that you shared your experience with us, the goods and the bads, because that really helps us as a profession grow in empathy and compassion and helps us help our patients. And that's our whole reason, or it should be our whole reason for being in this profession. So thank you, Amanda. Thank you for your time and your passion. And moving forward, thank you for continuing to educate.
Oh, absolutely. And thank you. And thank you all for everything you do, what you're going to do. I mean, you are the most unappreciated group of people, but you're so loved. And thank you for all you do.
Thank you, Tribe. Thank you for joining us. Always keep learning. Have a great day, guys.